Welcome to CareHero podcast, where our mission is to educate, motivate, and inspire nurses and other healthcare professionals. In each episode, we explore how our guests successfully advance their careers and improve the lives of their patients and residents. We share practical tips and success stories to illustrate how you, our care heroes, can grow in your own personal and professional lives.
Hello, Care Heroes. Welcome back to the show. We're your hosts, Martin Hoy.
And I'm Gerard Hernandez. We've got a remarkable guest on today's Care Hero podcast episode.
Yep, that's right. We have Dr. Jaines Andrades, who is a trauma acute surgery nurse practitioner at Bay State Medical Center in Springfield, Massachusetts.
And she's got a very inspiring story and some great tips to share, including the importance of believing in yourself as you work your way from the bottom to the top, how important it is to work with others and put your ego aside, the significance of having a work-life balance as a healthcare worker, to never judge a book by its cover, and to never forget there's always hope.
Sounds awesome, Gerard. Let's go.
Welcoming to our show here, we have Dr. Jaines Andrades, who is a trauma acute surgery nurse practitioner at Bay State Medical Center, Springfield, Massachusetts.
Jaines, we always kick off our show with this question. All of our care heroes, including yourself, are superheroes. But if you had to choose one superpower, what would that be and why?
I would choose to be invisible. Just like the freedom to do whatever I wanted at whatever time. Like, let's say being a hero. Like, I could do positive things without getting so much attention. Because sometimes you do really good things and it's great, but you also get a lot of attention. And sometimes I like to go under the radar, be behind the scenes, and being invisible will let me do that. I could be wherever, whenever, and I'd be able to help people so that I could do good things for people without them really noticing.
You could be their guardian angel.
Yeah.
I love that. I love that a lot.
Now, Jaines, you have such an incredible story that, we've seen featured on major news networks such as, ABC, CNN, and CBS. But for our care heroes here that are listening who don't know it yet, could you tell us a bit about your life story, your background, and how you got into healthcare?
I am 29 years old. I live in Springfield, Massachusetts. I just became a trauma nurse practitioner in September. But my story in healthcare starts 10 years ago. I was working actually at Wendy's and was thinking of I need a more stable job. I was about to start nursing school and I needed something more stable because I had to pay my way through school. So the idea of working in the hospital popped into my head. So I just applied for everything, the gift shop, dietary, custodian, anything that I had the qualification for, I applied and I got the job as a custodian. And I thought this is awesome. I have a steady job that isn't as stressful as working in fast food, and the hours were great and they worked with my nursing. And then on top of that, I would be able to be in the hospital, and I knew that that would give me an upper hand with nursing. So I started working as a custodian in 2010, the same year that I started nursing school. I worked as a custodian for the 4 years of nursing school and graduated in 2014. I took a bit of a break from school from 2014 to 2016. During that break, I kind of got bored. I was from going working multiple jobs and going to school and clinical, but I decided, let me go back to school. So I started my nurse practitioner school in 2016, and then I graduated from the program in May during the height of COVID, which was in and of itself a fun experience, and then got my job, and here I am, nurse practitioner now.
Nurse practitioner back in the same hospital that you were a custodian with. It's just so inspiring just to hear that, it was a chance for you to be around the environment.
Yeah, absolutely. And any exposure is good exposure. Even if I wasn't in direct patient care, I could see how people manage situations. And sometimes it was even better because no one paid attention to me, because I was just cleaning the room. So I was able to see a lot of behind the scenes of things before I got into it. So it was great.
Yeah, so you picked up very practical knowledge while you were doing something else. So that's really terrific.
You may have had that superpower that you talked about. You're sort of fly on the wall, listening and learning.
Yes, it gave me the foundation that I needed to build on.
There's been studies about, custodial staff at hospitals and how, with the right mindset, you can really be a very, very effective member of the team. There's a Yale professor who's written a lot about job crafting, and her research actually was specific to custodial staff at hospitals and how, if they're committed and they see a purpose in what they do, which is what sort of, it sounds like you had purpose in your job, you can do things like rearrange the photos in a patient's room or talk to them during the evening, or those kind of behaviors really affect the patient's experience at the hospital.
Also, it helped give me perspective to my job today, because I think sometimes the higher you go, you forget about where you were, but it gives me a different perspective. Like when I'm frustrated because I want a patient to move from the emergency room up to the floor, I remember those times where I was the person who had to clean the room and my pager kept going off and it was room after room that I had to clean, and I was doing the best I could. But, the best wasn't fast enough. So that reminds me now as a provider waiting for that room that there's somebody out there who's trying their best. But, there's more patients than there are workers. So it just always reminds me to see the bigger picture, that I'm a member of a team. I'm not the team.
Very powerful.
So earlier, you said you received your Doctor of Nursing practice, and you got that at the College of Our Lady of the Elms in Chicopee, Massachusetts. And your scholarly project was in medical emergencies in the outpatient setting. Could you tell us why you chose that?
So I worked part-time in outpatient clinic. It was a community health center helping the underserved population in Springfield. And I was looking for a project that meant something to me, because this scholarly project was 2 years of work, reading studies, putting things together. So I knew that I needed something that I could commit to and I was really passionate about. And I really enjoy teaching. That's a really, really big thing. Any knowledge that I have in my brain, I just want to get it out there. What I know, if I get it out there, then that's a piece of me that's going forward. So I wanted to find a project that united inpatient and outpatient, because I enjoy both. So I enjoy the fast pace of the hospital, but I also enjoy the continuity of outpatient, like seeing a patient over and over again. There was a situation where a patient, while I was at work in the clinic, he was overdosing. I kind of watched the dynamics of how everyone dealt with it and saw a gap in practice there. People weren't 100% sure on the dose of Narcan or how to give it. I saw a gap in practice and I was like, boom, there we go. I'm going to develop something with this. And then I thought of the rapid response team or the team approach, because that's something that inpatient works very well. We have the rapid response nurses along with the providers, respiratory therapy, phlebotomy. It's a whole team that comes to this patient's aid. So I was like, how amazing would it be to combine those two things? It was combining outpatient and inpatient. And then I saw this gap in practice and I was like, boom, this is great.
Wow, that's amazing to hear. I love to hear that, actually. You're applying your knowledge, and that's really just amazing to hear that you saw that gap and you took your knowledge and applied it. And that's something that all of our listeners can learn from.
Did you establish a rapid response in the outpatient setting?
Unfortunately, the idea didn't go beyond my project because logistically, also COVID happened. So there was no way to continue the group teachings. So basically, the project was multiple parts. So one was a protocol. So if a patient were to have what was believed to be cardiac arrest or an overdose, an allergic reaction, then that's when this team would come together. Another part was teaching the nurses how to use emergency equipment. But again, because of COVID, those teachings couldn't happen in the same way. Unfortunately, once my project ended, the rapid response team ended as well. The idea is there, it's solid. Unfortunately, I wasn't able to keep on with it.
That sounds like a great idea. So Jaines, what does a typical day look like for you?
A typical day for me usually starts around 5 to 6 a.m., depending on the amount of patients we have. So our patient list is made up of all the trauma patients that come in. So it's anyone who's had any kind of physical trauma. Usually gets labeled a trauma patient and we take care of them. So we're made up of a team of an attending physician, and then we have residents and APPs, the advanced practice providers, a nurse practitioner, and 2 PAs. And that team meets at around 5 a.m. to talk about the patients and get ready to go see the patient. Usually we have a list of about 15 patients that we take care of, but we can go up as high as I've seen 45. We do something that's called run the list. We talk about all the patients and then we round on them, meaning we go up to the floors, we talk to them, evaluate them, and give them a general plan of the day. Then we meet with the attending physician and again talk about the patients, tell them, their physical exams, how they're doing, and the plans that we think are appropriate for them. Our attending either okays those plans or makes adjustments based on, like patient safety or what's best for the patient. And then we split up and divide the work. The work being writing notes, putting in orders like x-rays or MRIs, talking to the orthopedic doctors, the bone doctors, or the neurologists, and then we do tasks. So those could be dressing changes, putting in chest tubes, taking out chest tubes. And in between all of that, if there's traumas, then we go down to the trauma bay and assess those patients and take care of those patients. Then at the end of the day, as a team, we meet again and we run the list for probably the 4th time of the day, making sure that we did everything for the patients and setting things up so that the night team has as much of a smooth ride as possible. And then my day usually ends anywhere between 4 and 6 p.m., depending on how crazy it is. I only work 3 days a week, so it's cool.
Do you find that it's such a variety of tasks and patients and issues and that you don't get tired of it in the same way that you might have felt after you initially graduated?
Yeah, because there's so much to learning how to do the dressing changes, or you have to order an MRI for a patient, and then you learn why we're taking the picture we're taking. So not only is it there's a huge variety in tasks, it's constant learning. You're constantly on your toes, and then to add a little spice to that are the traumas. So you could be typing away at the computer and you get a page that there's a 27-year-old who got into a motorcycle accident. So you're completely changing gears and, literally running to go help that person. So there's just no way to be bored.
And you also work with a whole variety of practitioners. And do you have any tips for our listeners on how to best work with an interdisciplinary team?
Leaving your ego aside, we're a team and we're all important. As long as you have the patient's well-being at heart, your opinion is valuable. I would say not getting caught up into the hierarchy of things and just remembering that you're part of a bigger team, and regardless of what's perceived, your opinion is important. I think that's always important to remember. Keep your ego at bay and don't pay attention to other people's egos.
And thank you again for such terrific detail on your day there. So, and I feel like you might have already covered the answer here. I know what you're going to say almost, but what do you most love about your role then, given this?
As a nurse practitioner specifically, I love that I can have that really fast pace going from a trauma to changing a dressing, but there's still a part of me that's a nurse. I can be a provider and I can give orders and things like that, but I can always be a nurse and hold the patient's hands and talk to them and support them.
Thank you. The versatility of your role makes a lot of sense. And related to that, what do you think is the biggest challenge you have with your current role right now, and how do you deal with it?
My biggest challenge right now is being a new provider. My first day by myself, in terms of I was the only NPPA on the team, the rest were residents. And it was my first time by myself. They gave me the pager. The pager wouldn't stop going off. I'm trying to discharge people. I had a patient who was like, their heart rate was all over the place and everything was just happening all at once. And to top it off, at the end of the shift, like literally I get off at 2, at 1:52, we had a trauma. So then I couldn't leave. So at the end of that shift, I posted, wearing a white coat isn't just about looking cute. The realization that now I have authority to make decisions and I really, really have human lives in my hands. It's a huge blessing, but it's also a huge challenge and it's a lot of pressure. I just deal with it by taking it day by day, asking a lot of questions, maybe sometimes being a little too cautious, but I feel like I don't have room to be like cocky at this point. Right now, I need to absorb as much as I can. I'm just trying to be safe and I'm trying to learn my role. It can be exhausting sometimes because I'm learning from 5 a.m. to like 5 p.m., but I just make sure to take it serious because I do have human lives in my hands. So it's important. I can't like get overwhelmed.
Not being cocky, leaving your ego aside, asking tons of questions makes a lot of sense. And you'll learn. I mean, this is the start of your journey as an NP.
And you have to continuously learn to really stay on top of your role, right? So what would you recommend to others who would be following similar footsteps? I know you said it could be exhausting, but what tips and tricks would you have to help them stay ahead of things?
Time management, because you need a life outside of being a nurse or nurse practitioner, doctor, like maximizing the time you do have. So like when I'm at work and things aren't so crazy, I make notes of things that I didn't understand and I go back and I ask questions. I just try as much as I can to take the time, especially where I'm at work, and just fill it with the learning, fill it with asking questions so that when I'm off of work, I'm off of work. I really am huge about a work-life balance. And a lot of the times you kind of get consumed because you're new and you want to just do the best and you want to learn as much as you can. But I also think it's important to have like a work-life balance so that you could have a life outside of work.
Absolutely. Those are great words to live by, at least for managing your time, personal space away from work, certainly.
You're not getting paid to study at home. So if you have time at work to get better at your craft, invest all of that at work and then leave work at work, and at home, be you. Being a nurse is my job. It's not who I am. So I like to make sure I make that distinction because it's really easy to get burnt out.
What other strategies do you have to keep sane? Burnout is a huge issue. It sounds like you have a pretty good way of dealing with it. Other than time management, in your personal life and your professional life, how do you deal with staying healthy?
I have a good support system. Several of my friends are nurse practitioners and the others are nurses. So I use that time to vent, kind of to get it out to, I had a really crappy day at work, or could you believe they ordered this for a patient? Like I kind of debrief with my friends and have that support network. There's just times where I'm just Jaines. I just take time to zone out and be myself. And I think that that's really important. And sometimes it's something as simple as watching a soap opera, things like that, because that like takes my mind away from it and gives me a break. I can keep it together.
I was looking at your resume and I want to talk to you about your time as a correctional nurse. You did that for 4 years. At the same time, concurrently, you did a little bit of work in HIV and addiction. Taking a break and being yourself makes a lot of sense. That might help you empathize with your patients because your patients are real people with real issues. And so could you comment about how you being yourself and empathizing with your patients has helped you in your role as a correctional nurse and also as an HIV addiction nurse?
I think those jobs really tested my empathy because I kind of fell into those jobs, really. I didn't wake up and I'm dreaming of being a correctional nurse. But I think that the important part of it was it taught me to be humble, to understand that you can't judge a book by its cover. I went into this job thinking oh my God, I'm going to work with criminals and it's just going to be insane. And it really wasn't. Like a lot of people who are in jail aren't bad, awful people. A lot of them are people who have been handed, like a crappy hand of cards. Not necessarily that they're bad people. A person like that could so be my brother, or a person like that could be my friend. Seeing people that I knew be in jail, it was just so eye-opening. But it reminds me till this day, like, you just can't read a book by its cover. You can't judge someone because of what you thought. Some people have just been put in bad situations. There was a lot of medical, yes, but it was more like mental health and support. I am so thankful for it because working with that population, I am who I am today. When I signed up for them, I never thought I would come out the way that I did.
Well, one of the symptoms of burnout is depersonalization of your patients. This is something that I think you're well prepared to deal with. So it sounds like you have all the pieces that you need to have a very long and successful career, which is great.
Jaines, so obviously you've had such a inspiring career, from being a custodian work, correctional nurse, HIV nurse, of course now nurse practitioner. So what has been the most inspiring or rewarding moment you've had thus far in your career?
Just recently working in the first surge of the COVID pandemic, when they say healthcare workers are superheroes and scrubs, I really saw that in the flesh. And I would say because there was such a level of acuity and none of us knew what we were doing. The best part of like healthcare is that like there's someone that knows what they're doing. Like whether it's a doctor, nurse, whoever, someone in the room knows what to do. And in this case, no one knew. And that made us band together to come up with ideas, to support each other through such tough times. And if it wasn't for my coworkers, I wouldn't have made it through that first surge back in March, April, and May, because no one knows what it's like unless you're there. Seeing how selflessly my coworkers put themselves in harm's way to care for others, it's something that I'll never forget. And I'm thankful that I got to experience it. They're there to save the day. And I saw the day being saved over and over again. So that was definitely my most inspiring moment.
Well, thank you for sharing that. And of course, thank you for the work that you've been doing. And the least that we feel we could do here is help share your story and others like you. So thank you for also inspiring us and the work that you've done.
If you could do anything to improve healthcare in America, what do you think you would do?
There's a lot of parts of healthcare that are money driven, and I wish that I could take that away. It's not realistic, but if I could take the money out of healthcare and make it about the patient again, not that it's said it's about the patient, but it really, really be about the patient, that would be incredible.
Money runs the world, but, we are hopefully moving to a place where, reforms in healthcare are making it more affordable and making pricing more clear.
And some people are bound to that, like someone who's diabetic and needs insulin, but their insulin is $500 a month. I mean, either they get the insulin or they don't live. So that means that maybe for this month, they don't have cable, or maybe for this month, they can't pay for their kid to go to dance class, and someone shouldn't have to pick between, am I going to eat today or am I going to get my insulin? I just think that in the United States of America, that people even have to think that is just, it's not right. Hopefully, sometime in the future, that will change.
Yeah, healthcare reform, big bucket list for the new Biden administration. So we'll see what happens in the next 4 years and beyond.
What's the best piece of advice that you have been giving yourself?
My mom used to always tell me when I felt that things could never change or I'd always be stuck in this rut, whatever that rut was, the best thing that God made was one day after another, because every day you wake up is a new beginning. I hold that near and dear to me. And sometimes I wake up and, sometimes you just wake up on the wrong side of the bed. And I think of that because it is just so true. The best part of life is that this terrible day, no matter how terrible it is, there's always tomorrow. and tomorrow there's hope.
What's the best compliment you've ever received in your career?
You're my guardian angel. And if it wasn't for you, I wouldn't be here today. I had a patient who was sick with a respiratory infection. I stayed with her all night. There was kind of like a pattern that I realized on how to avoid her getting that sick. So I started implementing things, and she was waiting to see her kids. She wanted to live, I think it was like 2 or 3 weeks longer to be able to see her kids all together. And then so in the morning when the sun came up, she told me that I was her guardian angel, and if it wasn't for her, she wouldn't be alive to see her kids.
That aligns really well with your superpower. I think you've been a guardian angel for many people, I'm sure, more than even this individual. Like Gerard said, thank you for everything you do.
Hey, Jaines, so is there any bit of knowledge you like to share with our CareHero listeners today?
Be kind to yourself. Be happy with your accomplishment. Believe in yourself. Be kind to yourself and pat yourself on the back. No matter what, you don't need to get a doctorate in nursing to be celebrated or to feel proud of yourself. Getting a job as a custodian is incredible. Getting a job at McDonald's is incredible. Whatever you do that's a stepping stone towards your ultimate goal is something worth celebrating. So be kind to yourself and celebrate yourself.
That's wonderful advice. And also, I would say to our listeners, be humble like Jaines, because her story is inspiring and there's a lot to be learned from here too, and the way she's very much handled and shared it. So thank you.
Say you get to travel to the future, Jaines. What does the future of nursing look like to you as a nurse practitioner or otherwise?
In an ideal world, a space where we all come together to benefit the patient. And again, I think it goes back to what I would change with healthcare, making things more patient-centered instead of money-centered. Getting to a place where nurses love nursing again. I think that there is a lot of burnout. There's a lot of nurses leaving. There's a lot of people who aren't happy. And in an ideal world for me, we'd get back to a place where bedside nursing is fun, fulfilling, and it's not this very stressful environment that it is today. 20 years ago, it wasn't all about titles and everyone was a nurse. We're all taking care of patients, and that's what matters.
So what you're saying is the credentialing inflation in every part of society is definitely live in healthcare, it sounds like. And that's what we've heard from before. It's education being such an important thing in order to move ahead in your healthcare career. Unfortunately, the byproduct of that is that you need to have some of these degrees or certifications in order to move ahead.
I guess for me, I would love to move away from standardized testing. Like, I understand why boards are there because they set a standard, but I don't think that being based on this one test is fair because there's many, many people out there who are amazing, incredible providers, nurses, whatever, but they're not great test takers. And I think we lose a lot of great people because of standardized testing. That doesn't guarantee that you're going to be good. It just guarantees that, I don't know, they can say, well, we thought you were going to be good because you passed this test. But just because you pass the test doesn't mean that you're a good provider. And then on the other hand, there's, like I said, tons of people who would be incredible providers, but can't pass the test. And I don't know. I'm not a huge fan of that.
It is not a great way to measure a person's ability to do a job. What are your hopes for 2021 generally?
Moving forward, 2020 was such a stressful year overall, but it's over now. And whether COVID is eliminated this year or not, just moving forward and learning how to live with COVID. Because I think for 2020, we existed. We were here and we did what we had to do. But I think in 2021, we should live, cautiously, keeping COVID in mind, but live and move forward and move on. Life has to go on.
Jaines, do you have any final thoughts or advice for our care heroes?
From one care hero to the other, just keep up the good work. We've really shown our value and what we bring to the table, so just keep up the good work.
Absolutely. Well, thank you, Dr. Jaines Andrades. We truly appreciate you taking the time to continue your journey inspiring others by joining us on CareHero Podcast.
Thank you so much for having me. This was amazing.
That was a really great episode, Martin. Such an inspiring story. Now it's time for the handover.
Okay, Care Heroes, here are our top takeaways from this episode. Believe in yourself. You have what it takes to work your way to the top. Any exposure into the field you want is good exposure. Leave your ego aside and work with others as a team. Don't get caught up in the hierarchy of things, and remember that your opinion is valuable. Work-life balance and time management are essential. Maximize the time you have at work to learn and excel in your career so you have time to relax, be yourself, and live a life outside work. Never judge a book by its cover. Always have empathy. You never know someone's situation or what they've been through, and sometimes good people are just dealt bad hands in life. And finally, at times when you feel upset, discouraged, or stuck in a rut, always remember, every day is a new beginning. There's always tomorrow, and with tomorrow, there's hope, so don't give up.
Wow, what an awesome handover. We also want to thank our Care Heroes for listening, and don't forget to rate our podcast on your favorite podcast app. If you want a shout out on a future episode, just visit careheropodcast.com. Go to the Contact Us page and submit your name, role, and location for a shout out on a future episode.
That's right, Gerard. Now it's time for some shout outs.
Yes, we want to give a shout out to Audrey, registered nurse from Los Angeles, California. Tamra, a therapist from Portland, Oregon. Rada, a registered nurse from Orange County, California. And Christina, a nurse practitioner from Bedford, Massachusetts.
All right, that's it, folks. We'll be back soon again. Same Care Hero time, same Care Hero channel.
Thanks for listening to CareHero Podcast. Don't miss out on future content. Hit subscribe and rate us in your favorite podcast app. Also, remember to visit us at careheropodcast.com to send us your feedback, sign up for the newsletter, and nominate a Care Hero to be interviewed on a future episode.